So it is a lumbar. It's a bone marrow aspiration needle.
The guard. What is the importance of this guard?
The importance of this guard is to prevent when we are using for bone marrow aspiration, particularly in the from the sternum, and if from using this guard we can prevent the injury to the great vessels during the procedure, as well as
this guard will prevent this needle passing through the sternum outside.
Yes, sir.
That is important, right? What is bone marrow aspiration in fact?
Sir, bone marrow aspiration is a aspiration of bone marrow. Bone marrow tissue from
bone marrow cells or material, or bone marrow itself from the bone. What are the indications of bone marrow aspiration?
So there are various indications for bone marrow aspiration. They include diagnostic, and from diagnostic there are two types of indications. First, in certain disease the bone marrow is essential.
Yes.
In some diseases the bone marrow is helpful but it's not essential. As well as it has value in prognosis of also and for therapeutic use also.
Yes.
So indications which are diagnosed from the diagnostic indications and which are very essential for bone marrow aspiration. First is aplastic anemia, megaloblastic anemia, leukemic leukemia also, myelofibrosis, myelosclerosis and multiple myeloma. And the indications which are essential which are not essential but are helpful are anemia like iron deficiency anemia, hemolytic anemia, and sometimes after medical therapy the anemia which is refractory to the therapy.
What are the other sites for bone marrow aspiration besides sternal puncture?
Besides sternal puncture, bone marrow can be done from the iliac crest also.
Yes.
And the spinous process which joins the spinous process also which joins the lumbar vertebrae.
And what is dry tap?
Dry tap is when there is no aspiration of bone marrow material during the procedure. And the indication causes can be faulty technique also.
Yes.
And if there is aplastic anemia, sometimes because of myelofibrosis and myelosclerosis also. These are the causes when.
What are the contraindications for a bone marrow?
The contraindication for bone marrow is if there is a presence of the blood dyscrasias.
Blood dyscrasias.
Yes, sir.
Or.
And if as well as if there is coagulation profile is deranged, so before doing the bone marrow aspiration one should get the all bleeding profile like bleeding time, clotting time.
And the person who is doing should be trained because this gives very important even life-threatening complications. Can you name some life-threatening complications of bone marrow aspiration?
Sir, bone marrow, if there is during cysternal puncture, if there is injury of the great vessels during cysternal puncture, if there is
sternal puncture,
sternal puncture,
yes.
If there is injury of the great vessels, then it can be fatal.
Right. And what are the prerequisites for bone marrow aspiration?
Prerequisite for bone marrow aspirations, like for any procedure, the injection atropine 0.6 milligram. As well as injection phenobarbital 50 milligram. IM should be given 30 minutes before doing the procedure.
Some analgesics also.
And some analgesics also to prevent the pain during and after a procedure.
Name some bone marrow contents, normal contents of a bone marrow.
Sir, usually we get contents in bone marrow aspiration is blood cells which is containing nucleated cells. And the amount is 20,000 to 1 lakh cubic per.
How will you identify, Dr. Neeraj, that it is a bone marrow aspirate when you do it?
Sir, usually as we know the bone marrow aspiration has fat globules.
Yes.
And after seeing on smear if there is fat globules we can easily say that the patient we have aspirated the bone marrow.
Yes, and it doesn't end there. You have to keep slides ready, spread it over and make good bone marrow slides. That is another important art to make a bone marrow slides, right? Good. Now, I had given one aspiration needle earlier. Now, you told that respiration needle is differentiated from lumbar puncture needle by not having a cut at the end, beveled end. What are the, in fact, sites where this aspiration needle can be used? Can anybody respond from this audience? Yes.
So the aspiration needle can be used for aspiration of pleural fluid,
Yes.
and sir, in ascitic typing.
Yes. Sometimes for ascitic type, for your benefit, I may tell you, there is a trocar cannula, separate trocar cannula, but you can use this also. Sometimes this hurts because this is sharp beveled end, right? Now, what are the indications for pleural fluid aspiration?
Sir, whenever there is massive pleural effusion up to the clavicles,
Yes.
or if there is sir, bilateral pleural effusion, if there is persistence of pleural effusion in spite of antitubercular therapy,
Yes.
if the pleural effusion is causing cardiorespiratory embarrassment,
That is therapeutic aspiration.
yes sir.
Yes. And diagnostic you already told. What are the common causes of unilateral pleural effusion? Sometimes this question can also be asked. Yes.
Sir, pneumonia,
Well, pneumonia is not a very common cause. What are the other causes?
Tuberculosis, sir.
Tuberculosis, yes. Malignancy,
malignancy,
yes. Sometimes even congestive heart failure, yes. What are the contraindications of pleural fluid aspiration?
sir, if pleural effusion, sir, if
Contraindications could be a local infection.
sir, local infection,
Yes.
if it sir, effusion is suspected to be infective in pathology, sir,
Yes. But
or-
then it also
or
has
sir,
to be
if it is
aspirated.
hemorrhagic,
Yes. But they are not contraindications, pleural fluid aspiration. They are the indications rather.
sir, actually there is no contraindication.
No, except that there is a local skin damage or the patient has some bleeding diaphysis, which also is not an absolute contraindication, right? Now, can you explain the technique of pleural fluid aspiration?
We are not looking.
Sir, patient is
He is made to sit
yes sir.
in the bed over a cardiac table.
Yes.
Is
Or,
leaning.
sir, sir, patient may lean forward
Yes.
with sir, arm resting on tip of bed table.
Yes.
Sir, then we
And then you tap and find out which is the best area where is the maximum dullness and the lowermost area.
Yes.
All right. Then.
sir, then we do part preparation by
Yes.
cetabolone,
Yes.
iodine and spirit. Sir, after this
Same procedure. You give local anesthetic.
we give local anesthetic in form of 2%
Yes.
lignocaine in skin, subcutaneous tissue
And-
and sir, parietal
And
fluid.
then what you do is that you have to gradually introduce the beveled end slowly inside. You don't hurt the lung tissue. And when you enter the pleural cavity, then there is a sudden gush of fluid coming outside and you take out. The dictum is that as long as the fluid coming freely is, you take it out, even if it is for diagnostic purposes, because whatever fluid you have to remove, you remove that, and then I could send for examination. Now, can you differentiate a transudate and exudate pleural fluid? How will you say it is transudate pleural fluid or exudate pleural fluid?
Sir,
by protein contents?
yes sir, by
cells?
protein content, cells.
Yes.
Sir, and by serum and pleural fluid albumin gradient. Sir.
Yes, that's right. Good. Please sit down. Yes, take your seat. Now we talk of ascetic tapping. The needle can be used same but a smaller one, it's a thicker one, bit bored, and sometimes even trocar cannula can be used for aspiration out. Now, what are the indications for ascetic tapping? Can anybody respond?
So when there is marked abdominal discomfort with
Yes.
cardiorespiratory
Embarrassment. Yes.
and in case of refractory recurrent
Similarly, so it is same diagnostic and therapeutic. Diagnostic indications would be to find out what is the type of fluid. Is it exudate? It is transudate, hemorrhagic. Okay, and then you can send it for culture if it is peritonitis. But then there could be other indications for when there is a cardiorespiratory embarrassment. There is a maximum amount of ascetic fluid which has to be tapped out. And the contraindications of ascetic tapping are?
So when there is hepatitis with impending coma,
Yes,
then
that
we
is
should
one.
avoid
You don't
those,
remove large amount of fluids. Yes. What else? Again, local infection, deranged
deranged
coagulation profile, or the patient has blood dyscrasias, bleeding tendencies are there. Again, now once you are told this ascetic typing is required, what complications do you expect after a tapping, or what precautions should you take?
So the complication that we usually expect after tapping, the patient might
you may introduce infection. Iatrogenic peritonitis is very common once you don't take care of all local antiseptic septic precautions. That is one. And else, when you remove large amount of fluids, there might be shock.
Patient might
Large
go
amount
into
of
hypotensive shock.
Proteins are lost. Large number of proteins are lost. Or there may be some bleeding tendencies. You may rupture some viscous when you are doing it is not careful, right? Now we talk of common rubber instruments, and the commonest one is rise tube. Now, can somebody respond? Yes. This is rise. You identified.
Yes.
How do you identify this is rise tube?
Very
Yes. Go ahead. The tip contains some metallic.
metallic.
Yes. These metallic balls are for what purpose they are there?
By doing X-ray, we identify.
Yes. When this is in the patient's stomach,
Yes.
if you do some radiological investigations, you can pinpoint and say where is the position of the rise tubes. That is the advantage, right? Now usually, go ahead.
Then there is indication for the rise to, sir,
Yes.
in case of the gastric lavage in case of the poisoning.
Normally we have a gastric lavage tube, but for children it's difficult to pass in a, sometimes you don't have a gastric lavage tube at your level, sometimes, then you can introduce and do it.
Yes.
What are the other indications?
Sir, in case of the feeding in unconscious patient,
Hmm.
then sir, in case of the GI decompression, in case of the paralytic
Yes,
intestinal obstructions. Sir.
Good.
These are the common indications.
And what are the precautions should be taken after its intubation? You already intubated, and this is in the stomach of the patient. What are the precautions we'll take?
Because we first look at that this tube must not be in trachea.
There is no?
Tube must not be in trachea, sir.
Yes. So you should check
Check the-
before giving any medication or fluid or anything else or milk
Yes.
that it is in the stomach. How will you check it?
Sir, in trachea, clinically there is coughing.
No, how will you check it that is in the stomach? See,
Sir.
when it is in the stomach,
Yes,
you
sir.
inject some air with the.
And then we auscultate in the
Yes,
gastric region. There is
yes.
rushing sound.
Yes. And what are the complications when you introduce it? One is that you told it can go into the respiratory system.
Then, sir, there is pharyngitis, rhinitis, pharyngitis, esophagitis, and aspiration pneumonia may occur.
Yes, aspiration pneumonia is one of the complications, but not common. And how do you insert it? If the patient is unconscious, how do you insert it? Through which, mouth or nose?
We insert it through nose, sir.
Nose, yes. Good. Now, in this context only, now what is this? Just come on here. What is this?
This is infant feed.
This is infant fetal tube. It's almost akin to the rise tube, but used for infants. And what are the indications for infant feeding tube uses?
So we use it in infant and children.
Infant children. But same, all uses are the same. Right. Now we talk, please sit down. Now we talk of some catheters, rubber catheters. What is this rubber tube catheter? Can you identify, Shalu?
So, it's a Milliput catheter,
Yes.
and it is used usually in the females,
Mm-hmm.
and it is not used in the male patients.
Not even in females. It is used for draining big cavities
It
or
is also
post-surgical,
used
post-operative.
in
Post-operative.
in
Because
postoperative,
no, let me
as well
tell
as
you.
in the
Because
patients who have
that
pneumothorax.
is that when you introduce it with the instrument, then it dilates like this. When introduced, leave it, and this goes into a cruciate form inside, and it stays in the viscous from where the drainage is required. Now, similarly, this is also akin. This is a Foley bag catheter. Foley bag catheter. Where is it used?
So Foley's catheter is used in the patients who have retention of urine,
Yes.
and post-operative patients,
Yes.
and in the patients who have enlargement of the prostate and which is inoperable also,
Yes.
and during as well as in the major surgery of the pelvic major surgery we use it.
And sometimes unconscious
In
patients.
unconscious patients also.
This is also used. Okay.
As well as for diagnostic purpose like in cystoscopy and cystography.
How will you introduce this in a male unconscious patient?
In a male unconscious patient, the position of the patient should be spine,
Yes.
and the genital area should be sterilized with the potassium permanganate,
Yes.
and the meatus should be held by the gauze piece,
Yes.
and the xylocaine jelly should be inserted prior to the insertion of the catheter,
Yes. Or it is
And-
lubricated with
and it is
xylocaine jelly.
lubricated with the xylocaine jelly,
Yes.
and we insert it up to the as it reaches into the urinary bladder,
Yes.
and we confirm it from the flow of the urine,
Yes.
and after confirming the position that once it has entered into the urinary bladder, we infiltrate with the sterile water,
Yes.
sterile from the with the normal saline also,
And
then we connect with the urobag also to measure the urine
that is one
output.
drainage.
That is one drainage.
What is the use of the second tubing here? Yes, this is one.
So this tube is used for infiltration of the balloon, which there is one balloon,
Yes.
and
That is how it is known as self-retaining catheter.
self-retaining catheter.
You inject about 20 cc of saline through this, so the balloon is inflated and it became self-retaining inside the urinary bladder.
Yes.
Okay. Now, any complication of a Foley bag catheterization?
Sir, complication can be trauma leading to hemorrhage.
Yes,
It can lead to infections also, and sometimes retention of
Yeah.
urine.
How
also.
long can this stay in once in the?
Sir, it is usually one time it can be used for 14 to 21 days.
Yes. Right. Now this is a simple rubber catheter. This is also urinary catheter. How do you differentiate between this and that catheter?
Sir, the difference between Foley's catheter and simple rubber catheter is it can not be used for permanent.
It is a single-use catheter.
It's single-use catheter.
Many
because
times,
it
yes.
doesn't have any balloon on the
Yes,
tip
yes.
of the catheter.
And many times for female catheterization also it is used. Now we are coming to an end to the session with 2-3 more important, very important things. Now this is, what is this instrument or tube?
Sir, this is endotracheal tube.
Yes. Where it is used and what are the indications?
So indication for endotracheal tube is the patient is unconscious,
Yes.
as well as he is having respiratory difficulty,
Yes.
and in the conditions where a respiratory failure is present,
Yes.
and in the and if the
For
patient
giving
has cough,
anesthesia to the patient.
and patient has bulbar palsy because of CNS disease, and
Yes.
cough reflex is
Yes.
poor to prevent the aspiration.
So essentially this is to maintain the airway
Yes.
and during anesthesia.
Yes, sir.
All right. And what is the importance of this bulb there? This cuff, yes, this cuff.
The
yes.
use of this valve is to fix the position of the endotracheal tube in the trachea.
So what are the complications of endotracheal intubation?
So complication depends which route is used for endotracheal intubation. Like if we use nasotracheal intubation, then can be complications are like epistaxis can be there, sinusitis can be there,
Yes, yes,
and sometimes this tube goes into the esophagus also.
yes.
And if the endotracheal
So you
intubation
have to
is
check
done,
yourself that this is properly inside.
yes, sir.
You inflate both the lungs and auscultate, right?
And when it is used, when the route of endotracheal intubation is orotracheal, then there can be dental trauma also, and balloon, if it is persistently fixed and it is not deflated, then there can be tracheal necrosis
Good,
also.
Good, good. Now what is this instrument or tube?
And it's a airway. It's a
Yes.
plastic airway,
Yes.
and
Where
which
do
is
you use it?
it's commonly used in the patients who have status epilepticus to
Yes.
prevent the tongue falling back
Good.
and to patent the airway.
Good, good, good. And what is this?
So it's tongue depressor,
Yeah.
and it is used to examine the oral cavity and to use
Good.
the gag reflex.
What is this needle? Just one.
So it's a vein flow,
Yes.
and it is used to replace or introduce the fluids into the circulation,
Yes.
and it is used as well as for parenteral medications and nutrition.
What are the complications of this venoflull needle?
Sir, complications can be local, like thrombophlebitis can be there, local swelling can be there if vein is encountered.
Yes.
Hematoma can be there, local infections can be there,
Yeah, and
and
sometimes
air
there is-
embolism also can be there.
Sometimes there is necrosis of the tissue and
Necrosis of the
the
tissue also.
medicine quality is such that it can cause necrosis. Very dangerous complication. How do you do it?
Sir, the common site for vein puncture is usually forearm and wrist.
Yes.
And if we are unable to put in on forearm and wrist, then the site can be used is feet and ankle, and the forearm is the clothes are removed from the forearm,
Yes.
and if patient has hair, then hair should be shaved,
Mhm.
and the tourniquet should be applied upper to the where the we are putting this cannula, and after distending the veins, we sterile the site from the simple split swab,
Yes.
and we go slightly obliquely and we press forward, and when it's enter into the vein,
Yes.
then blood comes and we remove the stillate and we connect the IVSS.
Good, good, very good. And this is the instrument last, this is three-way. It can be connected to this needle itself.
And, so
And what is the
that's it.
main utility of this three-way?
So the main utility of three-way are if we have one IV line
Yes.
and to connect the other line for any medications, as well as for in the procedure in tapping for pleural aspiration as well, and we can use for pleural aspiration also,
Yes,
and
this
as
can
well as
give
for
you an
monitoring the
edge.
CVP
Yes.
line also.
Yeah, this can give you an edge while you are taking out. You are not to remove time and again, and you can large amount of pleural fluid or acidic fluid or whatever fluid you are aspirating can be done. And when you are injecting also, you can maintain 3 lines. Okay. Now with this, viewers, I thank you all for patience listening and also the interaction which we have done. And the last line I'll always say is that when you are coming to the examination, you should be very clear about the things which you're talking, the identification, indications, contraindications, and its technique must be known to you. And complications is very important. Anything which you do, you must know what complication can occur. Thank you very much.
Thank you, Dr. Gupta. We would be back after a short break of 15 minutes in which Dr. Anuradha would talk to us about the common X-rays kept in the practical examinations, which would be presented in the pattern of mock viva examination. Thank you very much.
Thank you.